much. Mr. Shelby, thank you for your service. I have a question for you. The testimony mentions 422 new HR specialists hired into the VA, and that's good. While this is, again, it's progress. One of last year's GAO reports expressed concerns about the high attrition rate amongst the HR staff. I understand 13.5% in fiscal year 2015. Significantly higher than the VA employees in general. What does VA plan on doing to help continue the progress and retain those 422 new specialists you've hired in 2018?
Part of what we're doing is developing them. We've re-implemented a development program to make them more effective and efficient at their jobs. The other thing is we're way too decentralized, so there's too much demand at local level. We're consolidating into centers of excellence, so you have depth at any given organization, and they can shift their resources to the demand signal rather than have a full burden on a single one and you miss capacity where there is capacity. So we're consolidating those. And we also have to get operations much more involved in HR. The supervisors and managers have to get involved in talent management. They own their organizations. HR is a consultant to make sure we hire legally. They're the experts that run their organization and understand the talent they need, and so they have to be more involved. And so we're working towards that model, where HR is a consultant and a business partner, and we have operations supporting every effort to find the right talent to bring into those organizations.
Very good. Ms. Draper, do you have any suggestions? Does GAO have any suggestions, additional suggestions, recommendations for VA in order to reduce the high attrition rate?
Yeah, in their report that we issued in 2017, we made a number of recommendations, and it wasn't just about the hiring. I mean, the attrition was very high, but it's also about training the HR specialists and making sure they're adequately trained to do their jobs. There are other issues that we identified. One was problematic information technology systems that really did not support good practices, so that's another big issue. There are multiple systems that HR has to use. The other thing is that there's just poor performance management system that really does not provide clear distinctions amongst staff and their abilities, and also it limits employee accountability. And I think the other thing is that we identified is that weak internal controls, so the overall oversight of HR functions was inadequate. Okay. So those were all in that 2017 report.
Okay. Mr. Shelby, I mean, can you respond to that?
Yes, sir. We've addressed a lot of those.
To inadequately training, I mean,
we've implemented training. So there's no organization or school outside of government that's going to create an HR professional to work in the government, and in particular in the VA, we're the only education around Title 38, hybrid Title 38. And so we're implementing a robust development program to give those HR professionals that we bring in the education they need. Okay. But we absolutely need systems, right? When all the demand is on individuals rather than systems to support and self-service of our customers, there's always going to be too much tactical demand on HR professionals. We've upgraded our HR Smart system. We're cleaning up data corruption. I inherited a system that they told me was going to cost $120 million to clean up. We've spent nothing. We've gotten to the 70% solution. We're able to give accurate data on vacancies now. In the next few weeks, I anticipate us cleaning up enough where we can launch individual self-service and manager self-service. So as I alluded to, more and more onus upon operations to lead and manage their people, where HR can be consultants, and we can move them from the tactical day-to-day personnel actions up to the talent management, recruiting, and getting the people on board they need to run their organizations.
Very good. I have a second question. Again, for you, sir. VA is currently expanding residency training and has recently offered scholarships to those currently in school. You say in your testimony that the VA is in the process of completing a review of physician recruitment strategies. When will the review be complete, and what is VA doing for the current employees to ensure retention, such as education debt reduction programs, which is very important?
We're using every resource at our disposal to retain those we have. I personally don't think we tapped into enough. Almost every doctor in America, about 80%, come through our systems, and we haven't been proactive enough in recruiting those. Nurses, same thing, offering scholarships. We have to catch them early. We are exposed to them early in their educational career, and we haven't taken advantage of that. I want to start bringing in interns between their sophomore and junior years and vet them then. And then at the end, between their junior and senior year, vet them again. And if they're meeting the standards of the VA and there's somebody you want to bring on board, I want to start offering tentative job offers. So we get a whole year ahead of them. So a year before they're graduating, they have a tentative offer from the VA, and then using the resources you've given us with debt reduction and debt repayment in order to entice them to come.
Okay. Can we help you with that? Do you need legislation for anything like that?
Where we run into problems is caps, CARA caps, the recruiting, retention and relocation bonuses, we have caps. We appreciate the bump in that cap that we just had, but we have the resources there. We've already burned through that bump in the cap. So we absolutely need the flexibility. It's market-based. Somewhere we're going to have to offer more than in other markets. And if we have caps on it, we're always going to run into that.
Thank you very much for bringing that up. I appreciate it. Thank you. I yield back, Mr.
Thank you. Mr. Bilrakis now recognized for 5 minutes, Mr. O'Rourke from El Paso, Texas.
Thank you, Mr. Chairman. Mr. Steyer, I appreciate your points about the need to ensure that we have leadership. And we in El Paso saw firsthand the consequence of not having that leadership. We were out a medical center director for 2 years, had a series of interim directors. There was no captain setting the course and holding everybody else accountable. And we, at one point, had the worst performance in mental health care wait times in the country. Out of 141 measured systems, we ranked 141st. We, the veterans there, their families understood that care delayed became care denied, led to some really tragic outcomes.